The word fat has many definitions. It is both an important nutrient and an undesirable body type. It is a necessary component of the human body, but is harmful in excess. Two types of fat in our bodies are visceral and subcutaneous. Visceral fat is the fat that surrounds the internal organs, and subcutaneous fat is the fat underneath the skin. The location and type of fat make a difference. Fat may be stored centrally in the visceral and subcutaneous abdomen or peripherally in the thighs, hips, and arms. People who store fat centrally are said to have a pot belly or be apple-shaped, and those who store peripherally are pear-shaped. Visceral fat is strongly associated with type 2 diabetes, coronary heart disease, and breast cancer in women. Visceral fat produces more pro-inflammatory cytokines such as tumor necrosis factor and interleukin-6, which may increase the risk of cardiovascular disease and decrease sensitivity to insulin. Although both men and women have visceral and subcutaneous fat, gender greatly determines where fat is stored. Women are more likely to store fat peripherally and men centrally. Typically, a woman needs to carry about 80,000 calories of fat to get pregnant, which is best stored peripherally because it is broken down slowly and meant for more permanent storage. In fact, fat is stored in the hips and thighs and is very difficult to lose, except when a woman is lactating. Lactation makes these sex-specific fat stores increase their fat-releasing activity and decrease storage capacity. Postmenopausal women who have lower levels of estrogen may begin storing more visceral fat than before, perhaps because they no longer need stores for childbearing. There are 5 types of adrenergic receptors that determine how and where fat is stored. The beta receptors stimulate lipolysis, the breakdown of fat, and are more abundant in visceral fat. The alpha receptors promote fat storage and increase the number of fat cells and are more abundant in peripheral fat. Lipase also plays a role in determining fat storage. Women have higher lipase activity in the hips and thighs, while men have more in the abdomen. Because subcutaneous fat is generally smaller fat cells, they are metabolically healthier. Since they are greater in number, it is more difficult to decrease. Alternatively, visceral fat cells are larger in size but smaller in number. Since fat cells decrease in size but not in number, it is easier to reduce the size of the visceral fat than the number of the subcutaneous fat cells. Visceral fat has many more receptors that are sensitive to catecholamine levels, which are elevated during exercise. Therefore, exercise is an effective way to shrink the belly. Subcutaneous fat is much more difficult to get rid of. Liposuction is one option, but studies have shown that losing 30 pounds of subcutaneous fat does not possess the health benefits of lowered cholesterol, increased insulin sensitivity, and lowered blood pressure that are generally seen with the reduction in visceral fat.